Hello, my name is Molly Sullivan, and today I'll be talking more about multiple sclerosis. Multiple sclerosis is an abnormal response of the body's immune system that targets the central nervous system, which is the brain, the spinal cord, and the optic nerves, and it is a progressive disease. Inflamed nerves are damaged with the reduction of myelin on the fibers of the axon, which prevents proper transmission of messages from the CNS throughout the body. It is an immune-mediated disease in which the body attacks healthy parts of the body, in this case the myelin, and this is done by phagocytes, antigen-specific cytotoxin T lymphocytes, and cytokines. The nerve anatomy. The most important part of it is the myelin, which is a protective fatty coating that surrounds the fibers of the nerves and aids in signal transmission to the nerves throughout the body. And if damaged, it can slow the rate of the signal of the transmission and even stop it from delivering altogether. And you can see that in the first picture above. Myelin can be regenerated, which is good, but if the damage is sufficient, scarring can occur, and this cannot be fixed or regenerated. Relapsing remitting MS is the most common type of MS, and it is a clear, reoccurring episodes of neurologic symptoms, and they are new or increasing with disability. There will be a relapse, and after the relapse, there is a remission in which there is recovery of your symptoms. Some of them go away, but not all of them do, or all of them, they might not all go away, and that can make them permanent symptoms. And then it can be characterized as active or not active, which is relapse with a new MRI activity, or worsening or not worsening with increased disability condition. Secondary progressive MS follows the first initial RMS, and it is an increased neurological function over time. And as you can see in the graph, you can see in gray the RMS, and then it increasing with new MRI activity, and it once again can be characterized with active or non-active, or with progression or without progression. Primary progressive MS is increased disability of neurologic functions due to the onset symptoms, and it is without relapses of remissions. And once again, they have the same characteristics as the other two. Causes and genetics of multiple sclerosis. So it's not inherited, and the cause is unknown, but researchers think that has something to do with the body's immune response. Most common in ages from 20 to 50, but there are also cases in children and older adults. Women are 3 times more likely to be diagnosed with MS than men, and is most common in Caucasians and Northern European ancestry, but it is present in most ethnic groups. Environmental factors can also play a role in the cause of multiple sclerosis, like low vitamin D, smoking, obesity, and the geography of where you live. Some symptoms of multiple sclerosis are fatigue, pain, muscle weakness, numbness or tingling, lack of coordination, tremors, visual disturbances, slurred speech, dizziness, bowel, bladder, and sexual function problems, and trouble with walking. Secondary symptoms can also result from the primary symptoms, like depression and behavior changes. It's important to note that symptoms can be different in every patient because it's a very unique disease, and it is also unpredictable. The diagnosis of MS is done by a series of evaluations, tests, and background information done by your physician or doctor. These include MRIs, CAT scans, neurological and physical exams, blood tests, and medical history. It's important to note that there are no specific tests that can identify someone with having MS. And early diagnosis is key, but can be very difficult since symptoms are irregular and different in each person. The steps to follow when diagnosing someone is first to identify 2 places in the body that have nerve damage, and once done so, you need to be able to determine that both of these have occurred in 2 different times or 2 different episodes of MS. And then finally, you need to rule out any other possible neurological symptoms and diseases. Nearly 1 million people in the US have been diagnosed with MS, and 85% of them have been diagnosed with relapsing remitting MS. So that is the most common. Management and medication. There is no cure for MS, but you can do rehabilitation, including occupational, physical, and speech therapy, depending on the symptoms that are presented to that patient. And medication can also be used to manage the symptoms, the relapses, and prevention of the progression of the disease. Types of medications are corticosteroids, which reduce nerve inflammation, and plasma exchange, which also helps reduce symptoms and can be used if the steroids are shown not to be working in the patient. And different kind of medications can be infused, oral, or injectable medications. The effect of MS with an exercise response is interesting for MS patients because they have a low aerobic capacity, which will continue to decrease, and also increase the disability that they have. So it can lead to quick fatigue and limit exercise duration and intensity. And according to a study mentioned in the ACSM journal, individuals with severe disabilities were able to increase their VO2 peak with exercise, which is good because you can increase the intensity of the exercise, which will also increase the benefits for the cardiovascular system. Heart rate and blood pressure can be blunted due to autonomic dysfunction, and decreased muscle performance can occur. It's also common for patients with MS to have low heat tolerances, so you need to make sure that they are in a comfortable environment to work out in, and fans can be used to further help cool them down. Corticosteroids can increase blood pressure, blood glucose levels, mood swings, and retention of fluids. And disease-modifying medications have flu-like symptoms and irritation at injection sites, side effects that can limit exercise. So both of those side effects for the corticosteroids and the DM medication both need to be monitored throughout prescription exercise programs. And also the medications can be monitored by blood tests to make sure that they are working properly. People with MS tend not to be physically active due to the symptoms that they experience, but this is actually one of the best things that they can do is by doing aerobic exercises, stretching, progressive strength training, and yoga. It can help decrease the symptoms that they're experiencing with MS, like improving body, mind, and mood, strengthening arms and legs or any other part of the body, decreasing overall fatigue, and better control of bowel and bladder movements. In my case study for Miss EM, she is a 35 years old woman diagnosed with relapsing remitting multiple sclerosis. She has troubles with coordination, dizziness, and fatigue. The last episode she experienced was 1 month ago that had new MRI activity. Her dizziness has subsided, but still experiences fatigue and coordination issues from time to time. She recently has been able to go back to work and drive. She does not have a good diet and enjoys taking her dog for a walk each day. Miss EM receives treatment for occupational therapy and physical therapists to help reduce symptoms. She does not regularly exercise due to her symptoms causing her pain. She also takes 3 types of medication, and she is at a moderate risk with low disability. Her goals are to develop a healthier lifestyle that includes daily exercise, increase coordination in her body so that she can work in fluid movements, and reduce pain during daily activities. Her medications that she takes are Glyneal, which is a disease modifier which has side effects that need to be addressed in her exercise prescription. And then she takes Adderall for fatigue and Effexor for her pain. And some special considerations are that a medical clearance needs to be done before she is assigned the exercise prescription, and she should be working out in the morning when she has the most energy and is not as fatigued. For her exercise testing, to get her baseline, we did a YMCA test on the Monarch bike because it is a stationary test and is better for her to prevent injury if she gets fatigued. Her VO2 max was on the lower side, but not really bad, and she had a elevated resting blood pressure. And then we also did a series of strength tests to determine her hand grip strength and her leg strength and her flexibility, and she seemed to be either weak or on the average side for all of those, and her BMI was 28, so she is overweight. For her exercise prescription, being at a moderate risk, individuals with MS have similar guidelines to healthy adults, and modifications are needed and can be put in if she sees fit. She should be doing aerobic exercise for 3 to 5 days a week at an intensity of 40 to 60% for 20 to 30 minutes for the first week of exercise so that she can become comfortable, and since she was not regularly active. And then when she is comfortable, she can increase it to 60% and also increase the duration of the exercise as well. And RPE scale and monitoring her heart rate and blood pressure are important, especially since she is on medication that can affect them. Some types of exercise that are good for her are using a stationary bike, aquatic exercises, and walking your dog, since she mentioned she liked doing that. And then stabilizing handles can be put into the exercises as well if needed. Resistance training is also really good to increase strength in her muscles and improve balance and coordination. She will be doing this 2 to 3 times a week at an intensity of 60 to 80% of her 1 RM and sets of 3 to 4 with 8 to 12 repetitions. And it's important that she targets all of the main muscle groups in her body. And here are some examples of exercises that she can use. Functional exercises are also very important because they relate to her daily life. And she should be getting rest for at least 1 minute in between each exercises. Free weights and resistance bands are the best way to get her resistance training in. Yoga is lastly good to improve her range of motion, coordination, balance, and flexibility. It will help her reduce stress and improve her mental state. This was also good for her because she can help develop a better lifestyle and have new hobbies that benefit her health. She can do this for 2 to 3 days a week for 30 to 60 minutes. The intensity can be determined based on the type of yoga. Beginner's yoga and restorative yoga are good for an introduction into yoga, especially if she does not have any previous experience with it. Some precautions and modifications. She needs to make sure she's keeping hydrated, especially in humid climates, since temperatures can elevate quickly. Warm-ups and long cool-down periods can also help with this. Eating a balanced, healthy diet, psychological issues like depression and mood changes, and balance stabilizers and machines for stationary exercises are good modifications if needed. In conclusion, multiple sclerosis is a very unique health condition that can affect people in very different ways, and early detection of it helps increase the treatment success rate. And below is the link to the National Multiple Sclerosis Society if you have any more questions. And here's my works cited. Thank you.